again to my YouTube channel. It's me, Nurse Alona, your nurse educator and lactation consultant. Today, it's going to be a very interesting day. Since the other day when I had my breastfeeding summit with hundreds and hundreds of healthcare providers, the next day I received so many requests or emails from many nurses or many people wanting to become a lactation consultant or breastfeeding lactation consultant. So today, ilalaan ko itong video na to sa mga taong interesadong maging lactation consultant na katulad ko. So, you don't need to be a nurse, you don't need to be a midwife, or you don't need to be a doctor to become a lactation consultant. Ang kailangan nyo lang talaga ay may mga health sciences courses kayo in the past, when you're in college, when you're doing your higher education. Yung mga health sciences na courses na yun, halimbawa, biology, chemistry, earth science, psychology, ano pa yung pinag-aralan natin sa mga, nung nasa college tayo ng mga sciences. Anything mga sciences ay prerequisite po yan sa pag-take nyo ng lactation consultant. Now, when I work as a public health nurse, nung time na yun, parang ano na ako parang satisfied na ako, nurse na ako nagagampanin ko na yung tungkulin ko na magbibigay ng mga advice sa mga nanay, new nanays, or nagbibigay ng mga bakuna, mga immunization. But then, there were times na when I was doing home visit, and then suddenly may mga question ng mabibigat about breastfeeding itong mga pasyente ko. Feeling ko nagmumukha akong tangang nurse. I feel like I was a dumb nurse because every time they have questions about breastfeeding, feeling ko I don't have the right information to give to them or to answer their questions about breastfeeding, because again, when you're in the nursing school, I think natatandaan ko, I think we only have like 1 day or 2 days of lecture about breastfeeding, and that was it. Yun lang yung mga basic na latching, positioning, yun lang yun. Other than deeper problems with breastfeeding, I never experienced that in my nursing school. So one day I was sitting in my office, I was doing my charting, and then I told myself, there's really something lacking in my profession as a nurse. So sabi ko sa sarili ko, I need to improve my skills because I really want to grow as a nurse. Some people are so confident where they are sitting right now. It's okay. Some people, that's your choice. If you're confident, you're happy with what you have. Pero in my time, sabi ko, I need to learn something. So anyway, one day, I came up to I went to my supervisor and sabi ko, you know, I'm really interested in breastfeeding. I'm really interested to learn more about lactation consultations. Would you be supportive of my decision? Sabi ko, I'm really interested to improve my skills. Nagkataon naman na talagang napakabait yung supervisor namin, pati yung manager namin. Talagang they have full support kung ano yung decision ko para sa profession ko. So anyway, that's where the beginning. If you have a plan right now, you need to seek support from the management where you're working right now. Dahil to take these courses for a lactation consultant, it's gonna take you maybe about 2 years, okay? And within that 2 years, you're gonna spend a lot of money for the courses, just the courses itself. I'll tell you why. When you take the courses for breastfeeding, either you're gonna do it talaga either overseas, either you're gonna do from US, you're gonna do from Canada courses, or you're gonna go from Australia. There's some from UK courses. Any international breastfeeding courses will be credited to the IBCLC, which is International Board Certified Lactation Consultant. So it's credited, those courses. Now, those courses, they're not cheap, okay? For one course in a breastfeeding course, let's say breast anatomy and physiology. That's the first, I remember that was the first course that I took. It's worth like $250 US. So maybe that's about 10,000, 12,500, something like that in Philippine money. That's only for one course. You need at least 12 courses. So what I did for 1 year, I did 6 courses or maybe 4 courses because it was an intense course. In one course, probably it takes 3 to 4 months. There's so many studying to do. So it probably took me 2 years to finish 12 courses, okay? That's for the course. Now, let's talk about the clinical hours. So when you have your total of, I believe, correct me if I'm wrong, but you can log on to the ibcle.org. You can see there of how many hours now for the courses because sometimes they change it. So you need to log on to their site. Now, nung kinuha ko yung mga courses na yun, I believe 12 courses, and each course is, I think, mga 12 hours, equivalent 12 hours, but it takes me months to finish it. You pace your own time. Yun lang napakaganda sa mga online courses kasi may time kang sarili mo. Either you do it early in the morning, you do it in the afternoon, you do it at night. Anytime you can do it, okay? I can't remember kung may limit yung mga assignments, but it's always good to be on time. And there's really good discussions between different students from internationally. Kaya you learn so many things from every students, you know? So, ang ginawa ko noon, so I started enrolling courses from Australia. I think I did maybe 6 courses there. And then I enrolled again in US, another online. So, and then I enrolled again in some courses in Canada. So, I did not rely on, if I did not like the site, I go to different sites to take the courses. So when you have the courses done, so that's it. You get the hours for the courses. Now you need the hours for clinical. So ano yung clinical na yun? Clinical hours, it's counted. Okay, counted. If you are a nurse right now, or if you are a midwife right now, and you've been working as a nurse or a midwife or a doctor for maybe, let's say, for example, 5 years. 5 years. And in that 5 years, you only been doing maternal health, child health, anything you're dealing with mom and baby and breastfeeding. Count as your clinical hours between that 5 years. Let's say this is 2021, right? 2021. Let's say if you're gonna take your courses starting 2022, so 2022, 2023, hopefully you're gonna be done by your courses. Within that 2023, you go back 5 years before 2023. Yung 5 years experience mo yun sa clinical, magagamit mo yung hours na yun. So you can ask your hours from the HR department, yung 5 years na ginamit mong hours doon sa duty mo as working in a maternal health, maternity health, or a midwife, yung mga hours na yun ay mapapakinabangan mo to add to your clinical. Kung wala ka pang experience, let's say, you never have experience in maternal health, wala ka pang handle ng mga breastfeeding issues o mga ganun, so you need to earn at least, I think, 1,100 hours of clinical. Correct me if I'm wrong, maybe it went up to 100 more hours, maybe 1,200 hours now. So, yung clinical na yun ay yung how you assess mom breastfeeding, how you do maternal advice for baby care, newborn care, those stuff as long as it's related to mom and baby. So, if you have your time sheet or calendar sheet for the past years, you've been working 5 years before you finish, or after you finish the courses required, may mga 2 years, no? So, huwag niyong itapon yung mga clinical hours niyo, kung meron ka, doon sa mga tinatrabaho niyo. They're very useful talaga. Kasi ang hirap i-accumulate yung 1,100 hours na ginawa ko. Because in my experience, I think, before I took the, not yet, no exam yet. So, before I took the courses, I already have experience in public health, in maternity, on home visits. So, count yun. So, I have a big advantage. Kulang ko nilang ata ng clinical mga 400 hours. So, I work in a breastfeeding clinic 5 days a week, 8 hours a day. So, na-accumulate ko yun so quickly. So, that's the clinical hours. Now, here's the thing. The board exam. Ang board exam nila ay para akong Hindi ko kayo tinatakot, okay? Para akong nawala na ng utak sa haba-haba ng exam. I remember, I think 375 questions. Starts from 7 in the morning up to 3 in the afternoon. Depende kung gaano kakabilis matapos, okay? I believe there are all multiple choice. Ewan ko kung binago na ngayon because it's been, in my experience, it's been like maybe 10 years when I took the board exam. So there'll be changes for sure. There'll be changes for sure. So it's always good to inquire, okay? So yung multiple types of exams na yon, you really need to study. You need to have the books. The courses that you're gonna be taking online, may mga reading notes ka doon, but they are not enough to take the board exam. Maybe some people, sasabihin nila talagang matalino sila, talagang nakuha nila lahat yung question just for the courses. For me, I've experienced struggle with my breastfeeding courses is good, but I make sure I bought the books, okay? The books, they're not cheap. The most expensive book that I bought was about maybe 6,000 pesos each. It's a very thick book. And I bought maybe 3 or 4 books. So it's very important that you read the books as well as you read your notes when you want to take the board exam. I think the passing was 75%. So it was really, really tough. Believe me, the questions are sometimes out of nowhere. Talagang mag-aral ka, itindihin mo talaga kung ano yung mga nursing priorities, kung ano talaga all about breastfeeding, dahil talagang hindi biro ang parang kung board exam ko ng nursing was difficult, feeling ko mas difficult yung board exam ko sa lactation consultant. So I hope you learned something from this video. If you do have any comments, more questions about how to become a lactation consultant, or where can you find some reading notes, or where you can find study notes, feel free to message me, feel free to do your comments. Please share this video and like this video, and I want you to subscribe because you're gonna be learning so many breastfeeding lessons from me that you'll be able to use when you do your exams or when you do your courses. So I hope you learned something, and I'm very grateful that nakapagbigay ako sa inyo ng some ideas on how to enhance your profession. You should, if you can afford. To be honest, I had full support from my husband at that time. Para makuha ko talaga yung quick clinical hours ko, pumunta ako ng US. I went to US for a week. I did 1 week clinical training. Do you imagine? I stayed in the hotel for 5 days, and I went to school in San Francisco, Berkeley, and got my 65 hours clinical, I think, para lang talaga mapabilis. So it was worth it. It just cost money. So, but kung kaya ng bulsa, why not? Isang payo ko sa inyo. Kung ang facility nyo, kung ang management nyo, supportive sa inyo, at they're gonna give you a student loan or employees loan or whatever to enhance your profession, because every healthcare facility should have that program for their employees. So take that chance. Do not hesitate to approach your management kasi nakakabuti. You know what? When I become a lactation consultant, ako yung pinakaunang lactation consultant sa facility namin, lalong dumadami pasyente namin, lalong natutuwa yung manager namin, lalong naging improve yung aming facility dahil marami akong naging pasyente when I become a lactation consultant. So it's worth it. It costs money, but it pays good when you start working as a lactation consultant. So I hope you learned something from this video. Please don't forget to subscribe. Follow me because you need me for your breastfeeding courses or breastfeeding question. Bye for now, and I'll see you again in my next videos.